To everyone joining us, thank you for joining us. I really appreciate every single one of you connecting to the African Portal Radio TV International. It's another beautiful new month. It's a brand new month. We are in the month of August. And I'm so excited. Why? Because we are dealing with issues that have to do with our community. And this is El Talk on the African Portal Radio. Every Thursday, we come to your way to discuss each and everything that we know that will benefit your health, your life will be helpful to you. And that is why we are here again today to have another beautiful time. And remember, that all is the one that paid for this program and is the one that making it go viral. So go to their website and also follow them on the social media. Dr. ADEMOLA TOSIN OJO. This is their own giving back to the community. And this is another way to let you know that you can live a good life. And also, your health is very important. And that is the topic that we'll be dealing with for the last 4 weeks now. This is the fourth week, and we are into the 13 weeks. And after that, immediately after that program, there will be special giveaway to those of you that you are following us, to those of you that you are watching this program. There'll be a giveaway. So keep watching it. Glue to your phone as we are going to be having another segment of this program. And it's going to be a beautiful time. And remember also that the Farmer Summit is coming. It's going to be a great one in Ado-Ekiti. And everyone is looking for it. Everyone is talking about it. It's about to happen. And the only person that can do it, the man that's so concerned about the community, the one that knows that agriculture, farming is the only solution to the problem of our continent, Africa. And remember, this is not only about Nigeria, it's Africa. And that is exactly what we are saying. So we are global voice. We are not only for Africa. We speak across every step, every border, every country. Our footstep is there. The African Portal Radio TV International, to make sure that we live in a very good environment and also to make sure that you get nothing but the best. That is why this program is very important. Watch, like, share. Let me allow my guests to come into the program as we already know that it's going to be another great time. For those of you joining us, thank you very much. Joseph, just comment. Thank you, Joseph. Please share this program. The more you share it, the more you give it opportunity to go viral. And remember, if you glue to this program, the last segment of this program is going to be takeaway. It's going to be giveaway. So if you connecting with us for that 13 weeks, a gift is awaiting you on the African Portal through Dr. Ademola Tosin Ojo. So join me to welcome Dr. Ademola Tosin Ojo to another segment of this program this afternoon. Doctor, thank you very much for giving us privilege to engage you, especially in times such as this, the beginning of the month, when you are very busy. But you put it upon yourself that this is a community service and you have to do it because humanitarian is one of the most important things that we need to focus on. And that is why it's very important that we have this conversation. Thank you very much, sir. And how are you today?
Good, and you. And I would like to say that it's always a pleasure to be with you, with our wonderful host every week, Wednesday, to talk about health issues. And today's program is very interesting. Nobody can feign ignorance about it because it is all on us, especially in Africa. Thanks for having me.
Indeed, indeed. Thank you very much. I really appreciate your support and I really appreciate you believing in the call and also believing in the cause. And you have been a very great leader. You are using your own resources to also promote this program, which I really appreciate. And you, everyone listening to us, is not only on the African Portal. This program don't end here. If you go and pick up your Vanguard yesterday, Vanguard newspaper, we have the topic we treated last week on Vanguard newspaper yesterday, and on Sunday, on Sunday Independent, this paper is there. Also on other online newspaper and also some mainstream media. So why are we doing this? Is because we want to sensitize our community. We want you to have first information in your hand. And this week we are going to be talking about a very, very important topic, as my guest already mentioned. that is not a topic that you can miss. This is the topic that is very important, and also it have to do with Africa. It have to do with us. Not everybody will agree with me that this topic is very, very important, especially in time such as this. I read an article, I think about last year, somewhere last year, the wife of the president of Nigeria, that is Honorable Remi Tinubu, mentioned that we need to find a solution to malaria in Nigeria because it's a very serious problem. And I look at it and say, how are we going to find solution to this problem in environment whereby you go to some area, the canal that is around the area is alarming and is producing mosquito on a daily basis, and we are saying we want to deal with malaria in our country. How possible would this be? A lot of people living in environment, very dirty environment, unhealthy environment, and all these kind of things is happening. That is why it's very important that we talk about it. How can you prevent yourself from malaria, and what do you need to know about malaria in case if you don't have the first information? That is what this program is all about. My guest is in the house that is going to do justice to this program. Sir, once again, thank you for joining us. I really appreciate it. Let's get to the business of the day. Let's dive into it. As a matter of fact, let's nose drive into it. Sir, what is malaria and why is it important we need to talk about it?
Good. Thanks for today. As I've said, today's topic is quite broad, and in the sense that it has affected each and every one of us, especially in Africa and part of Asia, most especially. As we all know, malaria is a major public health issue, especially in African region, as we've all known, where it causes a high numbers of death, particularly among the youngs, especially the under 5 and the pregnant women, especially. And each year, it is reported that nearly 290 million of people are affected with malaria. And the death toll from this every year is about 400,000 people rapidly, and progress rapidly and cause the vast majority of severe disease and death in Africa. The second one, which is the most prevalent, is the Plasmodium virus, which is prevalent in Asia and South America. This one, it causes milder symptoms, not like the falciparum. The milder symptoms, and with these milder symptoms, mostly, it remains dormant in the liver for years, causing relapses. It comes, goes, comes and goes. You may treat it on the surface level at the bloodstream, disappears. But since it's encapsulated in the liver, it can relapse again and come back. Then we have other smaller ones in terms of epidemic, in terms of symptoms. We call them Plasmodium ovale. It's less common species and can also remain, it's found in the milder and the chronic infection, in a very milder and chronic infection. That one can remain like a chronic infection where there is little fever, just mild fever here and there. You don't really know the source. Some people may even mistake it as typhoid, especially in the West African section. And then the last one is the Plasmodium norisei. That one is primarily found in monkeys. It's not very common in human, especially in Southeast Asia. And it can spill over to infect humans, but not all the time. Those are the type of malaria we have, and these are the species, and these are the type of Plasmodium and the type of mosquitoes that can cause it. Thank you.
All right, thank you very much, sir. I really appreciate it. Those of you connecting, please kindly keep sharing it, keep talking about it, and also invite somebody to join this podcast. And it's also available on all our social media. You can watch it on Facebook, on YouTube, and also on TikTok and other media space. All right, let's get to the main aspect of this conversation. Sir, you have mentioned the types, the kind of the malarias, or these the malarias that can possibly affect, especially in Africa and also other part of the world. Let's look at how can we live in an environment where we can be able to say we don't have this mosquito around? Is it possible for us to live in an environment where there's no mosquito?
Yeah, it's difficult, but very possible. And that will quickly lead us to how it spreads. If you understand how it spreads, we should be able to know what to do to curb the menace. Because disease is a continuous biological cycle that occurs between human beings and mosquito. So when there's human, there's mosquito, there is malaria. If there is human without mosquito, you can't find malaria. If there's mosquito without human, there's no mosquito, there's no malaria. So this takes us to a single bite of this female Anopheles. It goes straight into its own, saliva, because the mosquito, the female Anopheles, will bite a human being and take that is already infected with malaria. If this mosquito bites somebody without malaria, the mosquito will not be infected and it will not be able to transmit it. So once it bites somebody that is having malaria, then it sucks up the malaria parasite into its own system. And the parasite will now develop in the gut between 10 to 12 days into the salivary gland of the mosquito. And when in the salivary gland of the mosquito, if this mosquito bites another person, it transmits that mosquito that has matured in the salivary gland into the bloodstream of the new person that is infected. And that goes straight to the liver and multiply. And from there, it goes into the blood. It goes into the blood, infects the blood. And that is the stage that triggers the classical symptoms of malaria. You start having fever, chills, rigors, shaking, and all the rest. And it could also be transmitted in few other ways, apart from the bite of mosquito, which we call alternative mode of transmission. And this could be from blood transfusion that is not well screened. When somebody is taking blood transfusion, if it's not well screened and contains malaria parasite, the person that is getting the blood may be infected. It could be transmitted through needle pricks if the other person is having the parasite, and also through mother to child transmission, because some of these plasmodium can reside in the placenta. And this takes me quickly to how to prevent it. Since we know the way it's transmitted, we can now join hands to break it down from one point to the other, how to prevent it. The first is to sleep under insecticide-treated mosquito nets. Like I said earlier, if there is mosquito and there is human being, that is when you can have malaria. But when there is mosquito and the mosquito cannot get to the human being, there's no malaria. So if you have an insecticide-treated mosquito net, you can never be bitten, especially in the evening. And you can still use mosquito repellents, especially through the night, because they are mostly prevalent in the evening and in the night during the dusk, so that they have enough time to fly and bite helpless individuals that are sleeping. So once you have insect repellent, then you deter them from coming close to you. It's still in that process of mosquito human beings. And you need to prevent the replication. That is the multiplication of this mosquito in your environment, because they reside in a waterlogged area. So you make sure you disinfect any water around you and you make sure they are clean. Also, you need to wear long sleeves clothing and long trousers that can cover almost every part of your body. And that deters them from, biting you. Then your windows and doors must be mosquito foolproof. You put screens there so that mosquito cannot get into the house. Also, like I've said, you keep your surroundings clean from bushes, from refuse, from waterlogged area, so that there is no place to hibernate and there's no place to, multiply in terms of breeding. Also, you need to be careful with under 5 and pregnant women, because under 5 are more susceptible because their immune systems has not developed, unlike the adult that's been beaten and has had malaria several times. During that process, they develop resistance, which we call a bit immunity. The under 5 are not having that much immunity. Even the pregnant women, because of the biological differences in pregnancies, there is a bit of reduction in their immune system and their immunity is a bit reduced. So the chances of the plasmodium parasite, traversing through the placenta is very high and can cause severe type of malaria. So these are the things to take note in order to reduce or stem the tide of this menace called malaria. Thank you, my host.
All right, thank you very much, sir. Thank you so much. A lot of people connecting, and I really appreciate it. Olubobolaye, thank you very much. I really appreciate you. I can feel you. I see you are commenting. Thank you. Keep sharing it. Keep talking about it. You are the co-host of this program. So, and the more you share it, the more you give it opportunity to go viral. Doctor, let's look at the people that already have this sickness, especially people in the rural area where they don't have access to a very good medical treatment. What are the recipe, or what are the things they can do in case if they cannot make it to the hospital, that they can treat themselves before getting to doctor?
Yeah. Most especially because of the endemicity of malaria in our surroundings, especially in Africa, most people are aware that prevention is quite better, and that is what we've just alluded to. Then, few things they can do is there is what we call malaria prophylactic treatment. In an area where it is endemic and there is little or no access to treatment, you don't wait until you are down with malaria. When you have that acute sickness, there is need to take what is called prophylaxis. And this is maybe on a weekly basis. And this is good for, the under 5, pregnant women, and those type of people, we call them sickle cell anemia, because they are very susceptible to developing severe form of malaria. So weekly prophylaxis is very good. And this is made available by the government in the local areas, especially in the clinics, where they are not well equipped to deal with overwhelming infection in terms of acute malaria. So these prophylaxis are there and they are revised. They are revised from from time to time to make sure that resistance does not occur against that and is quite effective. So this is one of the basic things they can do apart from prevention: weekly malaria prophylaxis. And then we need to understand that some of the governments, especially in Africa now, they are getting to the use of vaccine. And because there is this national malaria elimination program, NMEP, nationwide, that has made it available, especially for the under 5. Because if you can have vaccine against malaria, which has been well developed and it has been tested in so many other African countries, it will go a long way to reduce the burden of this disease. And this malaria has been tested in so many places, even in Nigeria, where it is being given in a doses of 4 different types at 5 months, 6 months, 7 months, and you give the fourth one, which is called the boosters, between 12th and 23rd month. So these are the few things that has, to some extent, reduced the extent of this. We could recollect during the COVID time, everybody was going for vaccine, because on a community level, that is what really stemmed the tide. Thanks.
All right, thank you very much. That's another very lovely one. And for those of you that you want to connect to doctor, you want to know more about how you can treat yourself. Maybe you have contacted this disease and you need somebody to help you. You can as well connect with us. Doctor is available on the social media handles. You can look for Dr. ADEMOLA TOSIN OJO. You can Google that on your Facebook, on your TikTok, on your Instagram. You can Google and you can follow him as well on all those social media handles. introduce. Doctor, how is malaria diagnosed?
Yeah, good. Um, Malaria, since we've discussed about how it is transmitted, we all know that it goes into the blood. Even before you know that you have malaria, uh, it will pass through the stage of being bitten by the malaria. It goes there to your liver to replicate before invading your blood cells. During the two initial processes of being bitten and getting to the liver, you don't feel any symptoms. But by the time it goes to the bloodstream and replicate further, develop further, and become so many, and once it's dispersed, that is when you have the first symptoms of fever, chills, and rigors. Mild headache, feeling tired, dizzy, weak, because it destroys the blood. Likely you have a bit of low blood, depending on the extent. So the diagnosis is mainly from clinical and blood test because of its endemicity. You walk into a clinic, you have these three signs: fever, chills, rigors, plus or minus headache. Even the healthcare attendant will actually say you are having malaria. Reading your temperature more than 30, 38, you have malaria. And then, even without any diagnostic test, healthcare professional will start you on malaria treatment immediately. And then do your test and start waiting for it. But this has been made so fast this time around because there's what we call rapid diagnostic test. In the years before, we normally take blood, send it to the lab where we do the thick and thin blood films. The thick and thin. The thing is just to diagnose the type of malaria. Is it falciparum? Is it ovale? Or is it vivax? Why the thick one is used to know the burden of that particular plasmodium in your system. How heavy you've been so infected, or how heavy has it spread in your system. But these days, you don't need to wait for blood result. You can just do it like take your finger prick, wait there, few seconds, the diagnosis is made, and treatment is done. Thank you.
Wow, thank you, doctor. Thank you very much. I really appreciate it. Let me open the line to allow people also to ask one or two questions from you, doctor, because a lot of people are out there. They don't really have much knowledge about this malaria and how to diagnose it and all that. And it's killed a lot of people in Africa, especially in Nigeria. So let me allow some people to call in. Thank you for calling in. And how are you this afternoon?
Good afternoon, also good afternoon, doctor. First and foremost, I want to
Thank you.
appreciate you for keep enlightening us, sir. The last week edition was very superb when we talk about the kidney health and the way we can cure it. And I must tell you, it's a life-touching project. May God continue to bless you. Now, quickly to this week, talking about the malaria. I stay in Africa, Nigeria to be precise. But doctor, I want to ask Dr. Ojo this question. What can cause malaria except mosquito? What are other things that can cause malaria, that can give someone a malaria? And what is the best way to prevent malaria if we don't want to go by using medicine? By drinking much of water, can we prevent malaria by drinking much of water? Or please enlighten us and expose us more on this, so that because malaria has been one of the deadliest diseases that has killed many of us, especially in Africa, in Nigeria. Please.
All right. Thank you very much for calling in. I really appreciate it. Doctor, the question I think is about you
Yeah.
already answered one of them, but what are the things, I mean, outside mosquito, is there any other thing or any other way people can contact or get malaria? Is there any other way? If there is there any way to treat except using the medication? Is there any other way you can treat malaria? The caller say by drinking a lot of water. Could that be another way of curing the malaria in the body? Doctor, you are the experience. I mean, you are the expert. Kindly respond to that.
Yeah, thank you, my host. And thank you, our wonderful, caller from Nigeria. We are quite appreciative of what you are doing, and it shows you are a very good, attentive listener. You are encouraged, and please do encourage others to do likewise. That's a very important question. It's not a layman's question, and it goes a long way to show that people are really, putting their mind into this health talk. Um, it's quite important that there are other ways through which malaria could be transmitted apart from mosquito bites. And sometimes some people may develop malaria and start wondering how they got it, especially if they've traveled from one place which is endemic to another place that is not endemic, and start wondering, is there mosquito in this country? Why am I coming down with mosquito? So, few ways. And the first one is through blood donation. If somebody, because sometimes if the blood is not tested with the newer diagnostic techniques, it's likely to be missed, because by the time the mosquito, the plasmodium, is in the liver and it's not in the blood, it will not be detected. And if that is missed, few days after, 10 to 12 days, it is released into the bloodstream and the person is infected, and that can transmit to another person that's going to get that blood. Or if the person is bled, few days after the person is tested, then you realize that the person that's getting the blood will definitely come down with malaria. Also, needle sharing, especially in those that are, addicted to drugs, sharing needles for narcotic drugs and intramuscular injections and intravenous injections. So if the person is overwhelmingly infected with malaria plasmodium, the parasite, definitely the other person could be infected. And in the newborn, malaria could be detected, especially if it has transmitted from the mother congenitally. We call it congenital transmission. This goes through the placenta into the newborn, and that can really affect it and cause severe malaria. These are the ways, other than mosquito bites, that malaria can be transmitted. Other than that, it's impossible. It is just impossible to get malaria from drinking water, or curing malaria from drinking enough water. Though, if you are infected with malaria, the likelihood you may not have, urge to drink water, because, and it is encouraged that you drink enough water, because once you start having fever, you lose a lot of water and you may be dehydrated. So drinking enough water will not cure the malaria, but will do a bit of retaining some level of water in your system, which is still good, but does not directly treat it. Thank you.
All right, thank you very much, Doctor. I really appreciate it. I'm already open the line for those of you that would like to call in. Remember, this program is 30 minutes, and Doctor is very busy. We don't want to stretch it beyond 30 minutes because of his busy schedule. And remember, this is coming to your way on the African Portal Radio TV International every Wednesday from 5 o'clock to half past 5 South African time. And for those of you that you are connecting outside Africa, you can as well share this program. Those of you in America, you are connecting. I got a lot of comment over the last week program from America. A lot of people watch it and commenting and giving kudos to our doctor that this is a very great man, and also you know what he's talking about. Thank you, doctor, for all your time. I really appreciate it. Doctor, before we go, what is the government needs to do? Can we totally eradicate the malaria in Africa? If no, what is the government needs to do to reduce the killing within the people, especially in Africa?
Um, Definitely. The government of Nigeria is doing a lot presently, and most other African countries are doing a lot. Even in South Africa, there is what the government is practically presently doing about it. The government of Nigeria has set up a national malaria elimination program, where there is they've put some few things into place. And here they do mass distribution of insecticide-treated nets to households because this is one of the first line of preventing malaria. And they do seasonal chemoprophylaxis, that's chemoprevention of young children and pregnant women. Like we alluded to, young children under 5 and pregnant women are most susceptible because of reduced immunity that they have. So if we can reduce the burden of the disease in this set of groups, definitely it will reduce the national calamity. So other things that they've done is the use of vaccine. And that has been, itemized the last time we spoke. So those are the major things that government is doing presently. Also, there is a mass campaign for facility-based distribution of long-lasting insecticide to be given to households to be used to curb the menace of, water pollution or areas where there's stagnant water that can encourage the breeding of mosquitoes. Then there's indoor residual spraying, where there is spraying of the interior of residential walls with safe insecticide that does not affect anybody, because this kills the vector mosquito that are hiding in those interior residential area. There's what you call larval source management, which is a targeted clearing and management of mosquito breeding sites in selected areas, because it's very common in rural areas. So government is doing that. We've mentioned seasonal malaria prophylaxis. There is still intermittent preventive treatment in pregnant women, where we use something like sulfadoxine, pyrimethamine combination to reduce this particular menace. Another combination in pregnant women that could be used is the quinine based with clindamycin. It can also be used. So these are what this national department are really into. And in other countries in Africa, most of their national government are having a policy to stem the tide of this particular malaria disease. Thank you.
Doctor, let me quickly ask this tricky question. Possibly you will be able to answer it and give us advice on it. Why is it that we only have the tsunami of mosquito and this problem only in Africa and also Asia and also in South America? Why not in Europe? Why not so much in Europe? I've never heard it, I mean, people talking about it so much in Europe and also in Northern America. I mean, does that mean that this particular disease was specially made for all these areas? What exactly is the problem? Why?
Yeah, it's quite reasonable, and it's quite evident that these are two geographical settings in terms of climatic conditions. In Europe, it's dead cold, and most times the mosquitoes will not survive cold. And if you could compare South Africa with Nigeria, you realize that it's not as endemic in South Africa like Nigeria. Nigeria is more endemic. It's still predicated on that same factor of differences in climatic conditions. And more so where it is colder. In South Africa, you don't have it unlike those that are not as cold in South Africa, especially in the Mpumalanga KZN side, especially the northern KZN, you have it more than any other places. But the difference in the climatic condition I'm talking about is more of tropical, where there is enough sunshine, because they breed well during this time. They mate, they breed, and they produce enough, and they can survive in a hotter climatic condition than colder areas. That's why they are not as endemic, and you can hardly see them in the colder temperate areas. Thank you.
Wow, thank you very much. I also wanted to enlighten the people about the yellow fever vaccine that some of the country always request that before you can travel, especially from the West African country to any part of the world, you need a yellow fever vaccine to, I mean, you need to have the proof that you have taken your, yeah, I mean, a lot of people think that it's not really important. Let me just give me the card. I only need the card to travel. I don't need the injection. What is your advice on that?
Yeah, it's good to have that because It's a particular type of mosquito that carries what is called dengue fever, which causes yellow fever. It's a dengue mosquito that causes yellow fever. So it resides too in a dormant form in the liver, and it can last for so long. And this type of dengue fever is very, very dangerous because it affects the liver and it causes damage to the liver cells, and reduces the chances of the liver to perform its function in terms of reducing and clearing excess breakdown blood cells, which is converted to bilirubin. So, and with that, when the liver loses the capacity to do this work or is overwhelmed, then this bilirubin is seen in the sclera of the eyes, which turns yellow, or in the skin and can be seen that the person is yellow. That's why that name is derived. So getting that, and it's quite endemic in Africa and especially West Africa. So if you are traveling, instead of importing that yellow fever disease into another country, if you have the immunization, then you are safe. It will prevent you from transmitting it, and it will prevent you from, acquiring, being infected by the mosquito, which is quite good. And it reduces the burden of the disease economically and even to one's health. Thank you.
All right, everyone. Thank you very much for joining us. This is Dr. Ademola Tosin Ojo live on the Health Talk on the African Portal Radio TV. Our topic today is how to prevent malaria and how to live in a free environment where the mosquito will not be able to transmit the malaria around. And that is what is gaining momentum on the African Portal. If you are joining us, no matter where you are, kindly share this program. Let it go viral. Remember that Dr. Ademola Tosin Ojo Dato is also available on all social media. So go to all social media, Instagram, YouTube, and TikTok. Go and follow Dr. Ademola Tosin Ojo for more about all this thing we mentioned. And you can also follow the African Portal as well and watch and share. Call us on +27842483384 for more information about what you need to do, how you can live a healthy life, and how you can live in a good environment. That is what is getting momentum right here, right now on the African Portal. Doctor, before I let
Good.
you out of our way because our time is fast spending, what is your advice to people listening to us across the globe?
Yeah. Thanks to all our listeners all over the globe, in Africa, in South Africa, in Nigeria. The advice is quite simple. And I'm sure we must have had this advice in the past, but it would be good if we sound it again that people should take it seriously. Early diagnosis and prompt treatment saves lives when it comes to malaria. If you do that, you eliminate the parasites as fast as possible. It reduces your chances of having severe malaria, which is the one that goes into the brain, goes to the eyes, the intestine, and everywhere in the body. And as soon as it's detected, you seek good medical attention. Complete the doses of your medications you are giving. If you feel you are not okay, go back and let more tests be done so that they can really decipher and diagnose properly what is happening to you and the best form to treat it. Because if it's uncomplicated, just tablets of tesmine, tesonate could be, or in combination, could be very effective. But if it's a severe form that is diagnosed as fast as possible, you will need a parenteral form, which could be in form of injection or giving you through your vein that goes to the blood. So early diagnosis and prompt treatment is very, very essential. And put it as an obligation that prevention is better than cure. Stick to those preventive method, and health will be better and the economic cost will be less. Thank you.
Thank you very much, Dr. Ademola Tosin Ojo. I really appreciate it. We have few weeks to go. We are going to 13 weeks and we just covered the 4 weeks. And I believe that this is another way we can sensitize our program. This is your give back to community. And I really appreciate it. And I believe people out there, they already got one or two things uh, about this program. They have already learned something new about how they can prevent themselves and also live an healthy life and also make sure that their environment is clean because cleanliness is next to godliness. I think that is one of the things we need to promote in Africa as well because most of our environment is too dirty. Possibly we need to look into that as well. So that some of our, especially in a country where they are still using the open gutters and all that. I think all those things needs to we need to get rid of all those things and get a closed gutter and also using a I mean something more better than what we are using right now in some parts of Africa. Thank you very much for your time, sir. I really appreciate it, and God bless you for joining us. A lot of people are calling in, calls are coming in, people are calling, and we try to pick up one or few calls to see if people, because we are about to round out, but the calls are still coming in. Let's see what we can do on that. We can't take any calls anymore. The time is already round up. That's what my producer say. So the time is we already stretched beyond the time budgeted for this program. But sir, thank you very much for coming out to be part of this program this hour. I really appreciate your time on the African Portal. Next week, we are coming back with another topic, another segment, and it's going to be a great time on the same channel, same time, same place. Next week, meet us. Don't miss it. And God bless you. Thank you, Doctor. Enjoy the rest of your day. God bless you.
You to my host.
Bye
Enjoy
bye.
your day.
Bye.
Bye.
All right, everyone. Thank you very much. That is Dr. Ademola Tosin Ojo, live and direct with us in the studio, telling us about how you can live a free mosquito environment and also how you can live a malaria-free environment. That is what is gaining momentum on the African Portal. If you are coming across this program, kindly share this program. One of the things I will learn about this program is that if you are questioning why is it that there is so much mosquito in Africa and not in Europe, doctor already gave us the answer to that question. Doctor said that it have to do with the weather because it's very cold in those parts of the world in Europe and America. And mosquitoes survive in most places where it's very hot. That is why there's so much, especially in Nigeria or in West Africa. So, in a place where it is very cold, especially during the winter in South Africa, you will realize that there is no mosquito. You sleep peacefully, no mosquito, no noise. There are some mosquito in Nigeria, no matter how you dressed, no matter how many nets you put on your window, they will still penetrate. And you know the funniest part of it about this mosquito in Nigeria is that they are so stubborn. They will go straight to your ear and make noise to to wake you up. They will wake you up before they bite you to let you know that they are rat. So they don't bite secretly. They will wake you up. Wake up! We need to suck blood. Some people say that some of the mosquito in Nigeria are not just normal. So women being attorney to mosquito to suck women's blood. I don't know how true is that. I can't ask that from the from my guest because scientifically that is not proved. So people are telling me that but you don't know that some of these mosquitoes they are women being. So women being taught the mosquito to suck blood. I don't know how far that is true. Maybe spiritually, maybe some people can prove that. But either way, what we are telling you is that live in a clean environment and make sure that in your environment using closed gutter, not open gutter. Those are all these open canal. If you go to some area in Lagos, you will see the open canal, and people are living very close to the canal. I can't imagine how people survive in those areas. But we need to live in a very clean environment. Africa, we need to make this continent clean. Let's do more work on that. I think our continent is a bit dirty. I'm not saying it's dirty. I'm just saying it's a bit dirty. So I think we need to clean our environments. We need to work on that. So thank you for joining us this week. I'm coming back next week, and it's going to be a great time. I believe you enjoyed this program. If you enjoy it, share it, tell somebody to tell somebody about it. And remember, you can follow Dr. ADEMOLA TOSIN OJO. You can follow him as well on all social media handles, and he's the one that is promoting this program. This is Dr. ADEMOLA TOSIN OJO Give Back to the Community program on the African Portal Radio TV International, your one-stop media house where everyone have a say. Have a very good evening to yourself. For those of you that are in evening time, and for those of you that you are in morning time, God bless you. Enjoy the rest of your day. God bless you. Have a good time. Bye for now.